you live in this area, there is almost a 100% chance you either have a pet or you're going to get one, because we're pet lovers in this area. Maybe you have some questions on how to care for your little loved one. Then get ready to give us a call, as we have Dr. Scott McDermott from Weems Road Animal Hospital here to answer all of your questions. Thank you so much for being with us again.
Thank you very much.
It's Valentine's Day, and I tell you what, my cat got extra scratches and love this morning.
Well, she has gotten a bunch as well. This is Georgia. She's my little 6-year-old dog. Yep.
Wow.
6-year-old black lab. And she is here to help us talk about dental disease on dogs.
And you can tell she's loved.
She is very loved.
Stroke me.
Yeah.
Okay. Dental hygiene for the pets.
Yes.
So we need to be concerned about their teeth.
We do need to be concerned. Client or pet owners are pretty well educated about vaccines and heartworm preventions and spays and neuters, but sometimes dental disease gets overlooked, and it's pretty important because not only does, we see the brown tartar on dogs' teeth and we smell the foul odor, but it's not necessarily the mouth that we're overly concerned about. It's the rest of the body. Because everything you see and smell is bacteria. So it leaches into the bloodstream, and every time her heart's beating, she's showering her heart valves.
And we hear that with humans, that people who take better care of their teeth actually extend their lives by a couple of years, and I imagine it's the same with dogs.
Absolutely. So it's a very important thing to take a look at. It's the nice thing about it is, if she has heart disease or something else, I can't look at her and physically see that. But dental disease, you can.
You can see that.
So we can look in her mouth, and all the owners at home can do the same with their dogs. And you want to do a couple things. You want to flip the lip up and look inside. And first,
will most dogs allow you to do this?
Most will.
Or do you have to train them?
Some of them you have to get them used to, handling the mouth. And actually, on our website, which is WeemsPetCenter.com, there's a video right on the homepage on how to brush your dog's teeth.
Love it.
And it addresses getting them used to touching their muzzle as well.
Okay.
But what you want to do is lift up the lip, and the first thing you're going to do is check for odor. If you smell an odor, that's bacteria. Bacteria has a foul odor.
And she's pretty odor-free.
She's pretty odor-free, and she's got some pretty white teeth, but you also want to look at the teeth as well. If you see any brown material in there, that's tartar, that's calculus. That's a sign that they have dental disease. If the gums are red and inflamed right along the gum line,
they should be pink?
They should be nice and pink and healthy like hers. She's got some black pigment, but the gums are actually nice and healthy. If they're red and angry, that's a sign of gingivitis, which is from the bacteria affecting the gums. And then if the gums are receded or pushed back, that's a sign of chronic disease as well.
So she's actually been very well taken care of, Dr. McDermott. Her teeth appear to be perfect.
We brush her teeth every day, and we actually apply an oral rinse to her teeth as well, and that helps keep the bacteria down.
Can we have a demonstration?
Absolutely, absolutely. I use a regular toothbrush.
A regular toothbrush?
I've got
soft?
Soft bristles, fine, soft to medium. If I've got a little dog, if I've got a dog that's 5–10 pounds, I'll use a little toddler's toothbrush. But the first thing you want to do is get them used to touching their face. And obviously she's had this a lot, but if you've never done this to your dog, just handle their muzzle, stroke their muzzle, let them get used to that. And that may take one day, or it may take a week or two to get used to it.
I just want to remind people that we are taking the phone calls 569-9390, 569-9390, because this is one of the few times you can just get Dr. McDermott.
I'll answer any question you have.
At your leisure. Okay.
But then we'll get to where we can rub their gums and let them feel comfortable with having a little bit of rubbing on their gums. Put a little bit of the toothpaste.
She likes it.
She does, and you can let them actually taste it. Most of them will lick it, rub that in their mouth as well, just getting used to that. But if you get the patient to the point where she tolerates that, he or she, then we're going to put a little bit of toothpaste on the toothbrush.
And this is?
That's a special toothpaste. It's a veterinary toothpaste. And it has an enzyme in there, and that enzyme will actually help dissolve plaque and tartar on the teeth, and it also does not have fluoride. That's very important, because fluoride is toxic if she swallows a lot of it. And she's going to swallow what we put in there.
So don't use the toothpaste that we use.
And don't let her eat the cat.
And don't let her eat the cat.
But what we're going to do is we're going to put a little bit on the toothbrush, and we want to do the outsides of the top teeth, and you want to focus on there. That's where they build up the most of their tartar and dental diseases, on the outsides of the top teeth. And you're going to do a nice little circular motion back and forth. Ooh, excuse me. And
dogs sneeze too, huh?
Yeah, they certainly do. But do a little bit of rubbing on the outside.
But she's right back. She's like, give me more, give me more.
And then you want to do the other side as well. 30 seconds per side. It's pretty tough to get the bottom teeth, because when they close their mouth, the top teeth occlude the bottom teeth, so you can't see them. But you just want to do 30 seconds per side, brush them real well, and that'll take care of those. Once a day is sufficient. The additive, or the rinse that I like to use on her, is another one that we squirt across there, and this is one that you just squirt right on the gums. And I'll usually do this 1 or 2 times a day, if I can remember to do it twice a day. That's an antibacterial rinse, so it actually kills bacteria along our gum line as well.
Okay, we have a phone call. We have Debbie from Columbus. What's your question? And thanks for calling this Valentine's, Debbie.
Yes, I'd like to know how should I bathe the dog?
How often should she bathe her dog?
If your dog doesn't have a skin condition, then there's really no reason to bathe them other than every couple of weeks. If they've got dry skin or any sort of skin condition where they've got sores or lesions, it's best to talk to your veterinarian about the proper shampoo. But if you're just bathing them to make them smell good, we want to use just a nice soap-free shampoo, and usually once every 2 weeks is sufficient.
Once every 2 weeks, okay. And before we take another question, this is a special rinse for the dogs?
It is. It's an antibacterial rinse that'll kill bacteria along their gum line.
Now, is this something they also need to be prepped for? Will they take this immediately?
Most of them take that immediately. If they'll let you brush their teeth, they'll certainly let you do that. Some dogs that won't let you brush their teeth will tolerate that very well.
And this is needed? Should you not brush without rinsing?
You can do one without the other, and because some dogs will not tolerate brushing, so we just use the rinse. Others, if you can do both, then we'll do both.
Okay.
For dogs that won't tolerate anything around their mouth, they just don't like having their muzzle handled, there's some things that you can do, which are these two products here that we'll talk about.
Now let's talk about this.
This is an oral rinse, and this, which camera are we on?
Okay,
and,
this is the oral
This is an oral rinse. You actually put it in their drinking water, and this is one that you put in their drinking water. Every time they drink, it acts as a mouthwash for their mouths, so it kills bacteria, so you don't have to worry about putting your hands around their mouth, using a toothbrush or anything else. So the dogs that are a little head shy, this is a great way to clean up their breath, helps the breath smell better and keeps the bacteria down. And then this is a dog food, and this is called TD. It's made by Science Diet. It's a prescription dog food. All of these products that we have here are prescription, but you get this through your veterinarian, and this is one that's actually a harder matrix dog food, so when they chew, it will actually scrape material off of their teeth.
I often wonder, Dr. McDermott, when I feed this to my dog, does this taste good to him? I'm like, oh, that must be awful.
She absolutely
but
loves
they do,
them.
yes.
They do, and I use it a lot of times as a treat. I'll let them eat their regular dog food, and I'll give her 1 or 2 of those afterwards as a treat. Helps brush off anything that's possibly caked on her teeth.
Okay, we have another call from Casita, Georgia. What's your name?
My name is Tina.
Hello, Tina. What's your question for the doctor?
I have a several dogs, and they always want to scratch their stomach chest, even though we bathe them, we spray them, but we spray.
Okay, we're getting a little feedback. Maybe turn down your television at home. We're getting some feedback. Okay, yes. When you call in, just make sure you turn down your television, because we'll get feedback, okay? And maybe you can call back in. Okay. Now, once you get the teeth cleaned and you've bathed them, then what are some of the other more common reasons that people are into
the veterinarian just to come? Most of them annual vaccines. They're going to get up to date on their vaccines, and then also just general checkups. We see a lot of skin and ear problems in the south because it gets so warm in the summertime. So we'll see a lot of dogs with hot spots or skin lesions. We will also see a lot of dogs coming in because of flea or tick problems as well. Down in the southeast, we see lots of fleas, and so we want to make sure we keep them on proper flea prevention and heartworm prevention year round.
Can I give her a hug?
You absolutely can.
I love dogs. I love dogs. My family has never been without them. My kids have grown up with them, so I love pets. And thank you so much, Dr. McDermott, for being with us. And come back, and our next topic will, whatever is hot then, come back and we'll make sure that people get some information.
We can do it. Thank you very, very much.
Thank you so much. You know, it's Valentine's Day. We want to give away another pair of Pine Mountain Wild Animal Safari tickets for you and your special loved one. So stay with us. That's coming up after the break and more. So stay with the Dee Armstrong Show.